Hello, everybody. I'm Bill Goldstein. I'm glad people are making their way through the traffic. Luckily, I've been here all day. I had no trouble getting here for the evening. I'm Bill Goldstein, and I'm the programming curator here at Roosevelt House, which, as many of you will know, is the Public Policy Institute of Hunter College. I welcome you on to this talk by Dr. Erwin Redlener on behalf of Jennifer Rabb, the president of Hunter College, and also Harold Holzer, who's the Jonathan F. Fanton director of Roosevelt House. Unfortunately, they could not be here at this time, although I think President Rabb will join us later in the evening. It's my pleasure to introduce Dr. Redlener, the director of the National Center for Disaster Preparedness and a professor of pediatrics and health policy and management at Columbia University. He's a nationally renowned authority in both fields, and in addition to his scholarly writing, he is the author of 2 books that showcase this varied expertise. His book, published in 2006, was Americans at Risk: Why We Are Not Prepared for Mega Disasters and What We Can Do Now. And his recent book, the book we're here to talk about tonight and to celebrate, is The Future of Us: What the Dreams of Children mean for 21st century America. Dr. Redlener was awarded an honorary degree from Hunter in the spring of 2001, so he is not a complete stranger, and I think it's even on his resume that he was associated with Hunter College. So it's wonderful to welcome back to Hunter, of which he is an honorary alumnus, and also to welcome him here to Roosevelt House to speak about his book. I know that he has been here before, but I don't think he has been the guest of honor in our auditorium. So I am very pleased that he is here to speak tonight. The house, for those of you who have not been here before, is the former New York City home of Franklin and Eleanor Roosevelt, who lived here beginning in 1908. The house was built for them as a wedding present by Sarah Delano Roosevelt, Franklin's mother, who, in addition to giving the house to them as a wedding present, built a house for herself next door. So it is 2 townhouses joined. Franklin and Eleanor Roosevelt and Sarah Roosevelt lived in the house into the White House years, and it's here that Franklin Roosevelt recovered from polio. There were elevators in the house from the beginning. And then also, when he was elected president in 1932, it's here that he met with prospective cabinet members. And in the FDR library on the 2nd floor is where Francis Perkins first proposed Social Security. So the Roosevelts sold the houses to Hunter after Sarah Roosevelt died in 1941, and the houses reopened as an interfaith student union in November of 1943. Franklin Roosevelt was in the Mideast at the World War II conferences in Cairo and Tehran, but Eleanor Roosevelt presided at the ribbon cutting, which was on November 22nd, 1943. So later in the fall, in November, we're going to have a series of events commemorating the 75th anniversary of the opening of Roosevelt House. The auditorium that we're in was the former kitchens and gardens of the 2 houses. So, a few words about Dr. Redlener, and then he will take over at the podium. In 2014, when Mayor Bill de Blasio appointed Dr. Redlener a special advisor to his administration, he singled out for special praise Dr. Redlener's innovative thinking and depth of knowledge of how we can best keep our city's most vulnerable populations safe. Innovative thinking and depth of knowledge that Governor Cuomo also drew on when he appointed Dr. Redlener as the co-chair of the New York State Ready Commission, NYS Ready Commission, last year. In the foreword to The Future of Us, Dr. Redlener's memoir of his life as an activist pediatrician, Jane Pauley, now the host of CBS Sunday Morning, recalls her long association with Dr. Redlener, which began in the 1980s, when he invited her to join the advisory board of the Children's Health Fund, which he had not long before co-founded with his wife, Karen, and the singer Paul Simon, who last week, of course, retired from live performing, something it does not seem, at least from his appearance here tonight, that Dr. Redlener has not decided to do. Jane Pauley writes of Dr. Redlener, the revelation of The Future of Us is just how many of the world's children Erwin sees. He's made it his life's mission to seek out children at greatest risk finding the roots of his affinity in the vulnerability and sense of difference he felt in his own childhood. At every step of his career, Ms. Pauley writes, Dr. Redlener has dared to imagine that the greatest social ills of our country, racism, malnutrition, child abuse, poverty itself, were reversible. It is appropriate, then, that we are gathered to hear Dr. Redlener tell us more about his work, his life, and the dreams of children in the former home of Franklin and Eleanor Roosevelt, who believed, as Dr. Redlener does, that the great social ills of our country were reversible. Dr. Redlener will speak and then take your questions, and after that, I hope you will all join us upstairs in the Four Freedoms room, where we'll have a reception, and Dr. Redlener will sell, and he'll sign his book. Thank you. Dr. Redlener.
Thanks, Bill, and good evening to all of you. And the aforementioned Karen Redlener just entered the hall. So, hi, Karen. So, beside the honorary degree that I very much appreciated that I received here many years ago, the other connection that we have with Hunter is that two of our children graduated from here. So we're like really, really big fans of the place, and I can't tell you how extraordinary it is to have this facility in New York City run by people like yourself, Bill, and it's just a remarkable reality that great things have always been happening in New York, but to have this Roosevelt House affiliated with Hunter College is just a, classical, wonderful marriage made in heaven kind of thing, much like my own. So, a week and a half ago, after getting a tour of the Texas-Mexican border by the Customs and Border Patrol officers, and then a intense several hours in an ICE detention center for people in El Paso, Texas, we had an opportunity, quite unprecedented, to speak with 42 women who were detained. They call it a detention center, but if any of you have ever had the opportunity to see a prison, it's a prison. They could call it an amusement park, but the fact of the matter is it's a straight up and down prison. And I had a really quite startling interaction with these 42 women, all of whom were absolutely desperate for what? For information, for finding out when they're going to be out of there, for finding out when they're going to be reunited with their children and their other family members. And they were in a forced limbo, awaiting whatever, adjudication of asylum requests or whatever. It was just a heartbreaking period of time, and very clearly representing a policy that just wasn't working. And I know it wasn't working because I asked before I met with the women, I asked the ICE guy, is this policy of deterring immigration by separating children from parents working? Well, I don't know, but we're having a surge in immigration, illegal and illegal, and a surge in asylum requests. So it wasn't working from his point of view. And when I spoke with the women, I asked them, how many of you would not have tried to make this very perilous journey here with your families if you had known what was awaiting you in America? And how many of your friends back home would be deterred if you could tell them exactly what you've experienced? And the answer was, yes, we would have, every single one of them. I'm talking about 42 out of 42. And nobody knew anybody that were facing the threats that they were facing back in Guatemala or El Salvador, Honduras, who would be deterred. So the policy was not only explicitly cruel, it was also not working. So cruel and stupid would be a way of characterizing it in a very real way. And then I visited a couple of child care facilities run by Health and Human Services, the Office of Refugee Resettlement, where there were young people ages like 12 to 17, a couple of thousand between two centers. I saw one in El Paso, one in Brownsville. And first of all, this happens to be, I've been taking care of vulnerable children one way or the other for a very long time. It's gotten to a point where I've given up trying to avoid this, but I cannot help thinking about my own children and grandchildren when I see kids like this. It makes me both appreciative of what we have, most of us have, and how much many other children do not have. And I was, in Texas, thinking about a visit last summer that I made with one of my colleagues to these refugee camps in in Greece for Syrian families. And in one of the refugee centers in northern Greece, I was meeting with families and talking to them through a translator, and there was a mom and dad and two young daughters, 8 and 5 years of age. And the daughter, whose name was Abir, the 8-year-old, I said, "What do you want to be when you grow up?" And she said, "I want to be a doctor." And the 5-year-old sister wanted to be a teacher. The problem is there was no school available to these children. And it was 2.5 years for the older one since she'd been in a classroom. So her future trajectory was being written in that refugee camp. And it was not good and not pretty. And it is a reflection that this is not, this has happened after my book was published, but I want to tell you about something that is in the book, which is sort of the same category of issue. And this was about 1990. I was the pediatrician on one of our Children's Health Fund, the foundation that Karen and I and Paul Simon founded, has these fully equipped pediatric mobile clinics. And they're like literally doctor's offices on wheels. And I was at a site in Brooklyn at a foster facility for very poor kids who had really never had much of anything ever for their entire lives. And they were moving from one shelter or facility to another. It was just, gruesome. And I would go in there and go down there, would see 15 or 20 children in the day. And I went to see this kid in the back examining room of our mobile clinic, and he was introduced to me. His name was William. He's 10 years old. His clothing was tattered. He was looking down. He was gaunt. He was not very communicative until I said the thing that I've said to, thousands of children over the years, and you probably say to children also, "What do you want to be when you grow up?" So William says, first of all, he lights up, he makes eye contact, he says, "I want to be a paleontologist." Now, the disharmony between the environment and this child and his aspiration was absolutely remarkable. And I said, "Well, what is a paleontologist?" "Somebody looks for dinosaur bones." I said, "Okay, well, how do you know about that?" He takes out of his pocket a little yellowed piece of newspaper. It was an article by a New York Times writer that was talking about a paleontologist who was working out west in the U.S., and just a description of him. That kid kept that piece of newspaper, and that was his lifeline to somewhere, to some anchor in the possibility of actually an opportunity. And I look at him and I'm thinking, there's no way this child could possibly become a paleontologist. And I was thinking about that, and again, my own children at the time, and my grandchildren now, basically they want to be a paleontologist, just get good grades, go to school, and go to graduate school. We'll pay the tab, I guess. Will we, honey? Or their parents will, somebody will. But there's no particular barriers to most of our children, I suspect, who wanted to have an aspiration like that. This kid had every imaginable barrier. So I want to read a little bit from the if I can find my glasses, I'll read it. Otherwise, do I have my glasses? I do. So literally 25 years later, I'm invited by a friend of mine named Bill Shore. Billy runs a really wonderful children's anti-hunger organization called Share Our Strength, a No Kid Hungry thing now. So we're doing a podcast, and we're just talking. He says, "What are you doing?" I said, "Well, I'm just finishing up this book." And he said, "What's it about?" I told him. He said, and I told him about this kid, William. So here's what I write about this. This is now, first I write about the kid and the experience, but this is about my interaction with Billy. "And while I lost track of William's whereabouts, he was never far from my mind. In the summer of 2016, some 25 years after we met on the mobile clinic in Brooklyn, I related William's story to an old friend and colleague, Billy Shore. He said nothing as I spoke, and when I finished speaking, he was still just staring at me. What? I said, well, why the look? Just this, Billy says. Last year, our 9-year-old, Nate, said he was interested in dinosaurs, and in fact, we've taken him to the museum a number of times to see dinosaur skeletons. He's got many books geared for his age on the subject, and he just loves to read about them. I say, well, that's great. There's more, my friend continues. Last year, my wife did some research and learned that a world-famous paleontologist, Alex Downs, was working at the Ghost Ranch in New Mexico, one of the top 10 dinosaur fossil fields in the world. And so, Billy says, we contacted Professor Downs, told him about our budding dinosaur hunting kid, and he invited us out to visit. And Billy continued, because we could, the three of us flew out to visit the scientist where he worked. He couldn't have been more gracious and attentive to our son, spending hours with Nate, showing him some of the discoveries and stoking his budding interest in the field. It was extraordinary. I really think the visit potentially cemented our son's interest, and I wouldn't be surprised if he actually stuck with the trajectory and ended up in research paleontology. Now, neither of us needed to say anything. It was clear that the gap between what William could possibly achieve and what my friend's boy could expect as a pathway, if he persisted in hot pursuit of an aspirational dream, could not have been wider. Possible and smooth sailing for the child of means, foreboding and essentially out of reach for William. And, that pretty much, if you get the book, by the way, all the profits for the book, should there be any, will be going to the Children's Health Fund, so this is not personal. But this story actually captures the issue, captures the problem, it captures my own personal mission, and it in some ways explains my own trajectory of going from early on really caring about the health of children. In fact, I was a pediatric intensive care unit director for a very large regional hospital in Florida, Miami. From caring about health, that's my focus, to then caring about, and this has been an evolution for Karen and I, we've been working together for 11 years? No, 47 years, actually. We've both evolved to this point where we think about not just health, because health is not enough. And I don't know what it is that I had in my little doctor's bag or on the shelves of the clinic in 1990 in Brooklyn, but whatever it was nowhere near as necessary for William as many of the things that he needed to get fixed that I didn't have the tools to fix. So anyway, we went from caring about the health as the only focus to now caring about success of children. And yes, good health obviously makes a contribution, and bad health can be real detriment and deterrent. But health is just a small fraction of the problem for children who grow up in poverty, discrimination, disparities that they can do nothing about. And it's a very sad state of affairs. But this moving from caring about health to caring about success of a child, and now I'm going a step further, which is what I care about now is children not just being successful, that is graduating from high school and getting good grades, but children thriving. Children thriving. A friend of ours who runs a foundation for children's issues in Arkansas says that every child is born a genius, and we just beat the hell out of it until nothing's left of it. And if they're poor and they're not going to school and they have other adversities that they're facing, then all of that potential goes to waste. And I think that reality is really what's driven my career and sort of story. But the question about the story, so when I was getting ready to write this book, I wanted to write a memoir for a lot of different reasons. A lot of young people, come to me and say, oh, Dr. Redlener, how could I do what you do and whatever? And I first of all, I always discourage people from thinking that, because as you'll see if you look at this book, my career's eclectic, right up to the border of pathology. This has been, I've run, not beyond, Bill, just near it. I could see it. But I did intensive care. I did a lot of disaster response. I I built a children's hospital up at Montefiore. I started 2 child abuse programs. I practiced for a few years upstate. It's too sort of serendipity driven to be a kind of a role model or a pathway for other people. Yet, I did want to capture what I've been doing and what I've brought from it, what I've taken from it, so that young people will have a sense of it. And I also wanted to just slightly therapeutic to write a memoir in a way, because it helps you figure out the times of confusion and where am I going exactly, what am I doing, and the book really was successful in that way. But so it's part memoir, and then it's part what I've come to conclude about children, what they need, and how vital the meeting of those needs is to our society, and in fact, to the planet. And that's in there too. It's mixed in with the memoir parts. But the other thing about the memoir parts, and even experiences from early in life, is that all these experiences turn out to be meaningful if you allow them to kind of percolate inside. You have an experience, you absorb it, you kind of like, what does this all mean? And I want to read another little section from the time of my life when I was quite young, as a kid, and we were living in rural Pennsylvania, and a place near Coatesville, Pennsylvania. And I never knew why we were living there exactly, but my father worked for the VA hospital system after the war, and we moved a lot. And here we end up, we're from Brooklyn. Here we are in rural Pennsylvania. I'm talking about living in half of a farmhouse on a really quite dilapidated dairy farm in Wagontown, New York, near Coatesville. It turns out the reason that my father really was not good with authority. He didn't fill out paperwork, so he kept getting transferred. So apparently Coatesville was our last stop. What do I know? You're a kid, you know nothing. Anyway, so there we were. At the time, maybe I was 8, and my brother was 4, and my mother was pregnant with a kid who was to be named Eric. Eric Gary, my youngest brother, was born in the summer of 1952, and the whole thing was shrouded in mystery, like so much else during that era, when it was generally thought that everything possible should be done to keep children out of the loop. Neil was just 4, I was about to turn 8. Mom was pregnant, that much we knew, and when she went into labor, our father drove her the 3.5 miles from Wagontown to a hospital in Coatesville. Thelma, the other tenant sharing our house, was left in charge. We were told that Mom needed to go to the hospital so the doctors could, quote, get the baby out, unquote, but not to worry, she'd be home in a few days. Turned out to be 10 very long days. In those days, people went to the hospital like interminably for pregnancy and delivery. So Neil and I couldn't get past the notion of, quote, getting the baby out, each of us having some sort of highly distorted picture in our heads about the reality of a baby in there in the first place. Neither of us would dare to ask too many questions, but out of childhood curiosity, I'm certain that we would have appreciated knowing just what the doctor was actually going to do to help with the arrival of our baby brother. I did not have any kind of usable mental image of a hospital, even, that I could bring to mind to help make sense of this. The following year, it got all real when a persistent ear infection with a high fever landed me in that same hospital for a week-long stay. Nowadays, ear infections are diagnosed in a doctor's office, and from the 1960s to the 1990s, the condition was treated with a simple prescription. Big breakthrough came in '85. A new vaccine was introduced that protects children against the bacteria that cause serious ear infections and so on. However, the situation for me as a 9-year-old in 1953 in a ward filled with cribs and hospital beds was clearly memorable and not in a good way. In a nutshell, I was feeling lousy, I was terrified, I missed my mother, but visiting hours, much like in San Quentin, was limited to an hour a day and strictly enforced. And if you have any recollection of any hospital as a kid, it was not the good old days. Parents only. 60 years later, I can still see the strikingly, profoundly unpleasant morning nurse scowling at me. Sit up, she'd snarl. Look at this mess you've made with those rumpled sheets and your pillow on the floor. Too upset and embarrassed, trying hard not to cry, all I could think about was the visit from my mother that would happen at 3 p.m. sharp every day. The important point of all this whining about an event that occurred decades ago was only that I never forgot how unnecessarily agonizing the experience was for me. On the clinical rotations later on in pediatrics as a medical student in Miami, as a resident in training, as the director of a pediatric ICU, as the pediatrician in the dregs and despair of Lee County, Arkansas, as a visitor to children's wards of hospitals in rural Honduras and famine-stricken Ethiopia, and as a doctor for thousands of New York's homeless children, I never forgot what it felt like as a 9-year-old boy hospitalized in Coatesville, Pennsylvania. Every experience I had seemed to have reinforced a fundamental truth about caring for vulnerable people, especially children who live with terrible adversity for much of their childhoods. Empathy and compassion for vulnerable people is the starting point for a career and a life committed to caring for children. In a way, I'm grateful to Nurse Ratched, or whatever her name was, who in '53 made sure that I was as miserable as possible in the children's ward of that hospital in Coatesville. I finally got to symbolically stick it to her almost 50 years later when we opened the Children's Hospital at Montefiore in 2001. I was the lead designer and ultimately president of what was considered one of the most innovative and family-centered institutions in the country. So I'm just making the point here that, yeah, we have these weird experiences, and for some of us, you kind of, and I'm, actually my brother's much like, one of my brothers, much like this. He's sort of blinders on. The serendipity thing is, he's directed. He did this, and they did that, and that was his plan, and the plan got followed through. For those of us who are cursed or blessed with this hypersensitivity to serendipity, it's a different story. And so I ended up banking that feeling that I had as a kid in the hospital myself, and then withdrawing it when it was time to design a children's hospital, which remains one of the most beautiful and innovative child and family-friendly hospitals in the U.S. And I think that this point about that I'm kind of emphasizing is that the experience collected among other experiences ended up manifesting in a really interesting way for me. So the experiences that I've had over these years have been interesting, and I put as many as I could, without embarrassing myself, put into this book. We ended up, for reasons which I'm happy to discuss with you, having dinner with Fidel Castro in 1999. The clinic that Karen and I were involved with in the early 1970s was a federally funded clinic. It was running out of funding because the Nixon administration was undercutting funding for all the federal health facilities like the one we were running. I randomly wrote to Joan Baez. This is maybe 1972, you think, Karen? 72 it was. And she ended up calling me in this clinic in Arkansas, and she came and visited with us, and she did a benefit concert in Memphis and saved our little clinic there in Arkansas. And we've been friends with her since. The situation with Paul Simon, I don't know, it's a long story, but a lot of weird things have happened, and many of these described, obviously, in the book. But I wanted to talk to you a little bit also before we get to wrapping up here, and it's about Arkansas. So I was about 27. I just finished my second year of residency and responded to a poster in the doctor's dining room at Denver Children's Hospital that said, it was a picture of a doctor walking down, a black and white photograph of a doctor holding a little black bag, walking down a very rural road and describing conditions in Lee County, Arkansas, which was the 6th poorest county in America at the time. And basically at the bottom, it was, Volunteers in Service to America. Do you remember VISTA? It was like the Domestic Peace Corps. That's who was running this. And said at the bottom, if you're not part of the solution, you're part of the problem. And I made the call, went to visit them, and dropped the pediatric cardiology fellowship that I had signed up for, and went to Arkansas. I didn't quite know where Arkansas was, but we checked the map. Do you know? Okay. Yeah. We checked the map, and I went out there, and I went there and spent 2 years there. We were in the market for a social worker, and it happens that Karen at the time was a graduate from Pomona, and she was at a VISTA training program in Texas, and she found out about this opening, and we ended up having Karen work for us, and that's how we met. But there we were in Lee County, Arkansas, and doing this thing. We'd have busy clinic days, but then the end of every clinic day, we'd be given a list of people who couldn't make it to the clinic. So we had this sort of arcane process that you may have heard. It was called a house call. Does that ring a bell? Yeah, you go. The doctor actually goes to where the patients are. It's a remarkable thing. So we would go every night, basically, and Karen went with me many times, and we'd go to visit these people in their homes and try to take care of them. But let me read you a little bit. I got in one afternoon, we got in a call. A nurse tells me that a kid was not looking well in a home. They got a call from somebody who had a phone, not this family, but that there was a baby who was ill, and we didn't know much about it, but what the details were, so we went out there with some urgency. So making a house call is usually pretty straightforward. One of the clinic assistants would drive me to the patient's house, sometimes 30 or 40 minutes away from the clinic. On this day, however, the clinic's regular car, a worn-out gray government-issue Ford, is out of commission. George, one of my clinic staff, volunteers to take me in his old pickup truck with a small flatbed and a passenger door that never feels quite securely closed. I grab my doctor's bag. We head out through Marianna, which is the county seat, down Arkansas Highway 79. I try to make idle conversation with George, but my mind is on that baby, and beside the truck is so noisy we can barely hear each other. Both sides of the road, even on the main highway west, we pass one decrepit shack after another, almost all with broken porches and tires and rusted auto parts in the front. Occasionally there's an old refrigerator on somebody's rickety porch. The signs of life are shoeless children in tattered clothes near one house, a gray-haired black man waving from the doorway of another shack. We pass a broken-down house trailer, small, dingy, yellow, falling apart but obviously occupied. Around the side, a very heavy woman is shooing some kids inside out of the rain, light but steady. Behind the houses, the soybean and cotton fields look orderly. Newly plowed furrows stretched onto the horizon. Huge tractors and harvesters were left midfield by the farmers until they returned to work in the morning. Just before we turn off the highway onto the gravel road, the light rain turned into a downpour. I glance at my watch, increasingly anxious to get to this baby. The pickup is doing poorly on the gravel, thrashing and bumping enough to make George as uncomfortable as I am. His grip on the steering wheel is tight, and he's staring straight ahead as we leave the gravel road and head down the last mile on a muddy, narrow lane toward the old sharecropper's shanty at the far end of Lee County, Arkansas. No more than 30 yards down the dirt road, the truck is in trouble. George is trying to plow through what looks like a small lake just in front of us when the truck comes to an abrupt halt. The engine's whining from the strain, but we're not going anywhere. Mired in mud, almost up to its floorboards and utterly bogged down, we can't move. God damn it, George, I gotta get to that patient, I'm yelling, and for very unnecessary added emphasis, pound my fist on the dashboard. Pushing the driver's door open, deep in mud himself, George knows what we have to do. He has his eye on a small farmhouse on the gravel road where he knows the farmer and would be able to solicit assistance in the form of a tractor and a winch. Half hour later, we're out of the mud, but I'm really worried about the baby waiting for us. For 15 minutes, we slip and slide until we get to the house, a miserable, dilapidated shack with a broken down porch and a door hanging on one hinge. The rain has stopped, but it's already been an hour and a half since we set out from the clinic. I rush up onto the porch, but step gingerly onto the rotting wood, some of the slats actually missing. I stand for a moment at the doorway, trying to get my bearings. It's dark inside the shack. My eyes are adjusting enough now to see unpainted makeshift wooden walls of the house. A black pot-bellied stove is just to the right, and the smell is pungent and musty. Directly in front of me, no more than 7 or 8 feet away, sitting on a torn, stained mattress on a rusted metal bed frame, the mother holds a baby, 6 or 7 weeks old, in her arms. Mom does not take her eyes off the infant, but greets me very softly. He's sick. I feel a chill and know immediately that this baby is, in fact, much sicker than his mother knows. Or maybe she does know. her maternal instincts telling her that this is a terrible situation. I have my bag and I'm walking toward them, and I say something in the way of an apology for taking so long to get there. Mom does not respond, but holds her sick and very undernourished looking infant up toward me. This baby is fading. My guess was that he had a bad neonatal infection, but there was no way to prove that in the shack out in the middle of Arkansas nowhere. Back in Denver, where I just finished my pediatric residency training, this baby would have been transported to a state-of-the-art pediatric or neonatal intensive care unit. The highly skilled team would have already started an intravenous line, done a lumbar puncture, drawn blood, and hooked up the vital sign monitors. But this is backwoods. This is the backwoods of an impoverished southern county. My pathetic little doctor's bag holds very little that can make a difference here. The walls of this hovel are nothing but rotted wooden boards, partially covered with old newspapers to keep out the coming winter drafts. I shake off the feeling of hopelessness and try to do what is possible in this place at this moment for this infant of poverty. I examine the baby and find what I expected. Shallow, rapid respirations, an accelerated heartbeat, skin pale and mottled, slightly bluish tinge as far as I can see in the dimly lit room. The baby feels cool to the touch. I wrap him for warmth and use a tiny rubber mask and breathing bag to keep him ventilated. We hurry back to the pickup. I'm holding the baby and the mom's right behind. The ride back to town is interminable, but at least we get through the mud and back onto the highway. In Marianna, we rush over to the little 25-bed Lee Memorial Hospital, a strange, unfamiliar medical facility that looks and feels like the dusty, impoverished town it tries to serve. I'm no sooner through the emergency room entrance when I'm told of two other urgent calls, one from a man not far from where we had just come. I can't believe what's happening. I hand the baby to the nurse and request immediate transport to Memphis. While we're waiting for the ambulance, I start an IV drip on the tiny patient to manage dehydration and start antibiotics. I should be drawing blood cultures and doing other tests before starting the antibiotic, but the nurses inform me that there is no infant's lumbar puncture set and they're out of blood culture bottles. I am enraged, shouting to no one in particular what the hell is going on here. I last see the baby being carried onto the local ambulance, accompanied by his mother and a nurse from Lee Memorial Hospital. The ambulance speeds away, and I stare out toward the highway until it was well out of sight. He'll be admitted to an intensive care nursery at the hospital in Memphis if he makes it. So where's my driver? I've got to get the hell back to the west end of the county. Another patient's waiting. So at that moment, not too far from the Mississippi Delta of East Arkansas, and a million miles from any place that's familiar to me, with 1 year and 9 months left of my 2-year commitment, another thought: will I make it? That's what it was. But, it's hard to remember the details of this, but I wrote them down right after they happened, waiting for this moment to include them in this memoir. But life there, and I think this is important as a balancing note here, was extraordinarily enriching for Karen and me. We made friends there. We interacted with patients. We had incredible colleagues to work with. And the experiences were coming fast and furious. But again, like I was saying earlier, all of them amounted to a memory bank, experiences that would play out in so many different ways. So when I finally did meet Paul Simon, because he was, do you remember the "We Are the World" song to deal with sub-Saharan African and Ethiopian Sudan primarily, drought and then a terrible famine that happened. Paul was one of the singers, and again, it's sort of a long story, but I was the medical director for that organization and director of grants. And the record, which 1985 earned $65 million, quite a lot of money now, and certainly a lot of money then. So my job was to help figure out how to spend the money responsibly and so on. And Paul, as one of the singers, one day called the LA office of USA for Africa. I had set up the grant funding office here in New York City, not far from here, in fact, and he asked the executive director of USA for Africa, could we keep some of the money here in the U.S. to take care of homeless children, hunger, whatever? And they said no, and the reason they said no was because people gave money and bought the record because it was supposed to be to help the famine. Not that they weren't sympathetic, it's just that, we have a pact that you make with donors to an organization, which is actually really important principle to understand. But Marty said to Paul, Erwin Redlener, I was standing in his office when the call came in, standing with me, but his office in New York, why don't you be in touch with him and he'll figure out some way to help do something. So Paul and I got together a couple of weeks later in New York in the fall of 1986, and I took Paul on a tour from hell in the squalor of New York City's shelter systems and its welfare hotels. And, by that point, I had already seen a lot of really bad issues, serious issues in my career. But what we saw at the Martinique Hotel on Broadway and 32nd Street, it's now got some other name, it's been renovated, but was a surreal vision of urban squalor, the likes of which it's really even hard to describe, although I talk about it in the book. But there were 1,000 homeless children and their parents in this hotel. And, the second floor on the mezzanine were maybe 40 desks of social service workers and other case managers and whatever, people from the Department of Education that were sort of there, and there was just chaos and a melee of people sort of milling around trying to get services and whatever. And once a day, the Coalition for the Homeless would bring a hot meal to families, otherwise that was it. And we saw lines of a couple of hundred children waiting online to get into the main ballroom where the meals were served. So this was it. This is what we looked at, and some other facilities in New York. And Paul said to me, we didn't say much really to each other. He was flabbergasted that his city and his country had this. And by the way, there were about 12,000 children every night in these shelters in New York in 1986. It was the beginning of the rise of urban homelessness in America. Unfortunately, last year, the average daily census of children in the shelter system was around 24,000, around twice what it was back in the mid-'80s. Anyway, so when Paul and I did speak about it, some days or maybe a week later, he said, I want to do something. What can I do about this? I said, well, I'm a pediatrician, and these kids were not getting medical care, many not going to school, and they needed clothes, they needed everything. But I went to my core strength, and I said, why don't we do a healthcare system, and we can make house calls here, except why don't we we'll take the whole crew, the whole medical team, and we'll take the whole medical clinic. And so that's this idea for creating a mobile-based children's healthcare program, Children's Health Fund, arose literally in that way. And Paul was just finishing up his Graceland album and was about to go on tour. So, I'd come up with ideas, but, what's it worth if it doesn't get materialized? So I needed somebody to really help figure out what this would mean and where do you get a mobile clinic and all that. So Paul and I literally took Karen out to dinner and talked her into not going to graduate school, but coming in and helping put this program together. And she did. So Paul gave Karen his offices, and he went on Graceland tour, and Karen was there for 6 months and put together the program, designed the mobile unit, ordered it, and then Paul and I tried to raise the money. Paul was like calling his colleagues, Springsteen or whoever he spoke to, but trying to describe what he saw and then what he was trying to do. And I hear him, I was sitting in his office going, no, it's a mobile clinic. No, on wheels. Well, no, the doctors will be in the mobile clinic in front. And it was clearly not sinking in what he was trying to do. And, excuse me. So then he said, I won't tell you exactly what he said. Anyway, he said, the heck with it. And he just himself wrote a check for the first mobile unit, which was $85,000 in 1986 when we ordered it. There are a couple $100,000 now, but That's what it was. And a year later, we started the Children's Health Fund. And then Paul did a big concert at Madison Square Garden, with all the A-listers at the time, and raised more money. We ended up with 3 mobile units. Then we transferred the base of operations from New York Hospital, Cornell, to Montefiore, where we still have a relationship. And now we have 53 of these mobile clinics in rural and urban environments around the United States. We've seen over 4 million healthcare encounters for children. And there you are, except there I was last week in Texas. And there we are looking at the data of homeless children now. And when I was writing the book, there's some data in there, obviously, and part of it I put in to show that over many, many administrations, Republican and Democrat control the Senate, Republican and Democrat control the House, and every permutation and combination thereof, the child poverty rate has ranged between about 11% and 21 or 22%, never below 10% of America's children living in profound poverty. The remnants, literally, of slavery and Jim Crow and institutional racism permeating everything about the lives of the children that we're trying to deal with. Hundreds of years of, being marginalized. These are the problems that appear from my lens to be intractable, and they shouldn't be, and they needn't be. And, we're just trying to figure out what's supposed to happen now. I sort of know what's supposed to happen, obviously, in November. You probably don't need to wonder much about that, but yeah, so we have issues, but a lot of the issues are not so acute, because I guess is my point here. They're chronic, they're ingrained, and they are a time bomb for our country, which is the other big point here. That every child that needs fixing, that needs remediation, that is not fulfilling his or her potential, is a tremendous burden on America's potential to really be what it needs to be. And now, more than ever, we are seeing consequences that are not pleasant, not pretty. And I think, I also run the National Center for Disaster Preparedness at Columbia, and been to many, we've been working in Puerto Rico after Hurricane Maria, in Texas after Harvey, in Florida after Irma. We did a lot of stuff with Katrina in the Gulf. Every single one of these disasters disproportionately hurts people in poverty. And for every family in poverty with children, it not only hurts them in the present, it hurts their future and our future as well. And this is something I don't think we've quite grasped what that means. You blunt the trajectory of a child and his or her potential, and you are costing that child the future, and you're really endangering the possibilities that America's sense of democracy and fairness and our influence will be diminished one at a time by every child that doesn't get a chance to fulfill an opportunity that he or she must have. So let me stop there and see if there's any questions or thoughts, criticisms. I'll take it all. Yeah. Anybody? Oh. Yes. Sir.
Yeah, hi. My name is Eric Roper, and I co-founded an organization originally called Hedge Funds Care, and now it's called Help for Children 20 years ago. We focus on mostly sexually abused children. I think over the course of the organization's lifetime, we've raised about $65 million, but we're a granting organization. In other words, we don't. Yeah. We get RFPs and we grant out the money, and we have now 10 chapters in the United States and 6 chapters outside the United States. Every chapter has to have a social service review. In our case, we use Columbia School of Social Work for that purpose. And I was interested in do you raise money, how do you keep maintaining your funding?
Sure.
For your organization? I mean, we all have different ways of doing it. We do benefits and golf outings and stuff like that. How do you, what's your budget, and how do you maintain your funding sources and activity to keep this wonderful thing alive?
Yeah, so it's a big, I'm going to actually ask Karen to chime in here, but since she's the operations director for the Children's Health Fund. So basically what this amounts to, we've been fundraising since 1986, I guess, and the current budget's around $14 million a year. And the money is raised, there's one category of funds are raised directly to provide the service, so Medicaid reimbursement, federal grants, and so on will come into any one of our programs around the country. But then centrally, we raised the $14 million to make sure that these programs are able to fulfill a very comprehensive state-of-the-art quality of care. And that's money is raised from foundations, corporations, individual donors. We have a very active board of directors and, a development staff who sweat it out every year. We're pretty much hand to mouth, as you can probably imagine. And, that's what we do. But Karen, do you want to say anything?
I think that's a good summary. We also do events, as you mentioned. Yeah, but we have 25 different programs that are now part of our national network. All of them have mobile clinics that serve
Some more than one.
some more than mobile medical, mobile dental, and they serve just franchise children in their own communities. And each one of those mobile programs are connected to a larger health institution in their community, a hospital or a clinic. We partner, as Erwin said, they raise the public dollars and the reimbursements, and we raise the private dollars to supplement.
Yes.
The question is,
You look good holding a microphone. Look at, have to
So
sing.
the question is this: you've said now that there's been an increase in the number of children who are in shelters, et cetera, and instead of it getting better with all the work you've done, and all what Karen has done, and everything else that we've tried to do, the question is, what is the solution to this? Because I've worked in schools for years, many years ago, and I saw the level of poverty. I saw foster kids. I saw children who were starving in tatters and all of that. And there was really nothing that was truly being done, little
Yeah.
bits and pieces of it, but it doesn't seem to be getting better with all the work we're doing. So what do you do? And how do you eliminate, so it's not 24,000, we live in a society where there will always be poverty.
Sure.
I mean, unless you live in a communist society, I guess, or somewhere else. But in this society, there always will be some level of poverty. And can we eliminate it as a society? Can we eliminate hunger? Can we eliminate homelessness? I don't know. I mean, I'm old, so I've seen it many, many years. So what do you do?
Well, I'm older than you are.
Well, not by much.
considerably, but anyway, but I think the point is, first of all, surprisingly, I'm actually pretty optimistic that we will be able to deal with this, because every time I look at a kid, mine or anybody else's, a child just being there represents the future and hopefulness. And I don't really allow myself to get despairing, even though I get angry. And I think there's politics involved here. There's other realities that have to do with what is it and how we're going to get to a place where we have a better understanding what's the common denominator. Yes, we're not looking for a country that everybody makes the same amount of money. There's always going to be disparities of income. That doesn't mean there has to be any children who are going to bed hungry at night in America. That's, so the basic support, there's two things. We need the support for for healthcare, for nutrition, and we need a good educational opportunity for every single child. And we need to support them all the way through. And we have to have no-cost options for people who are limited financial means to go to college. so we can sort of create some levelness, some evenness of the playing field, so to speak. But it's all doable. It's not beyond our grasp. And I think in some ways, this has been a rough almost 2 years for the likes of me. But I think in some ways that it's, it's like, this is how bad it could get. This is bad. This is really bad. But I think a lot of people are waking up to the fact that a lot of the things that have gotten ingrained and people haven't noticed, from poverty to misogyny to all of these things that are sort of in there, we kind of think, oh, this is the way it is. Well, it doesn't have to be the way it is. And I think activism, declaring where we need to be, and voting and speaking and collaborating in that way, it gives us will give us some sense of the way out. Believe me, I tell the story in Arkansas. I used to tell people, this was in the mid-'70s, early '70s. Oh, I came out of the Kennedy Johnson era. Well, we'll be finished with child poverty and problems with accessing health care. Maybe a decade, maybe 15 years. This can't go on. It's not going to go on. We were very activist and solution-oriented, and here we are, many decades later. And then we have grown children who are doctors. It's like, here, Michael, good luck to you. We were just passing the torch. But I don't really want that to be like that. And that's the other reason which I didn't mention, was the purpose of this book, is to say to people, this book is not a downer, actually, even though I read you some tough sections there. But it hopefully lays out a roadmap where people can get involved, what they need to do, what our goals should be. And that's what I think we have to just keep working on it. But I do think it's interesting. We'll see what kind of reactions our country has to what we've been experiencing. Well, the proof will be in the pudding. But I'm hopeful. Are you not hopeful? What do you think?
No, I'm very hopeful.
Yeah?
I'm hopeful, and then I'll shudder to put on the TV tomorrow if the hearings are going to be
Yeah.
televised, and then wait for a vote to see how our elected officials react to this current situation. But I'm hopeful for November. I don't need to get too heavy into politics.
Yeah, no, and I didn't mean just politically. I'm just talking about in general. This is a really big wake-up call, I guess is what I'm saying. And that wake-up call has political dimensions, but also all kinds of social dimensions and human, or the interactive relationships that we have with one another, what our expectations are, what you can do. There seems to be, I feel like some kind of moral lighthouse is going to be turned on that'll allow us to kind of see the world and the future a little bit differently. That's what I'm hoping for.
Well, I also want to just add a little bit, because, when we started the Children's Health Fund, there were many, many more millions of children that were uninsured, did not have health insurance at all. And one of the aspects of our organization was advocacy around improving access to care and improving insurance. And so, I don't know the numbers, or when you probably know the numbers better than I do, but, now there are only, 5 million children that are uninsured, and when we started the organization, there were 12. So, it's not, we're not fully there yet, but it's improved. And I think that's what that's what motivates me to continue to do the work, is that you can see change. And, and as more people get motivated, there's a collective voice, looking for improvements. So that's.
You had your hand up for about 15 minutes.
Thank you.
My name's Kyra Klein. I'm a school teacher. And first of all, thank you so much. I really appreciate it. As heavy as what you're talking about is, the title of this talk is very optimistic, and you are very optimistic about this. I work with children who have a lot of means. And as you talk about activism, I work at a school where we're really trying, and I think that even as I've raised my own children, trying to get them involved, right? And we look at what happened in Parkland and how they really, they are our future. Yeah. So I'm curious, because you also led with your children and you led with your grandchildren. How can kids be helpful? In the last 10 or 15 years, as my children attended schools here in the city, there's a lot about like community service, and some of this was about, getting credits for colleges and all of that type of thing. But ultimately, there is an authenticity that children have, and they want to connect, and they want to be helpful, and they see it in one another. Like there's something that's very organic when, an 8-year-old meets another 8-year-old, and there's all the other stuff sort of goes by the wayside. So I teach 3rd grade. I'm curious, how can kids help kids?
Well, how can kids not only help kids, how can kids help the rest of us?
Yes,
Yeah. And I think there's something very powerful in what you're saying, and I totally appreciate it. And I think we're going to see a lot more of that. The Parkland reaction was just the beginning, I think. And it was an article in the Times the other day about interviewing high school girls mostly, and I think a couple of boys also, about what they thought about what's going on with the Kavanaugh hearings and so on, and what's being revealed, and their own values. It was remarkable to read what these young people were saying. And the second thing is that children are not born with genes that lead them to becoming, racists or elitists, or they're born like they're pure, they're ready to get messages that are positive, that are optimistic, and that embed in them a sense of responsibility for others. And that starts with how they're treated by their parents and what their parents' values are, and how that's expressed to them, and unleashing that inherent goodness and brilliance that children are born with. And I think this is then really the answer to your question. It has to really start with parents. And unfortunately, not every kid has a parent like you. But I think part of this process of educating parents about how powerful, you're in this sort of micro relationship. It's you and a kid or a few kids or whatever you have. And that is the building block for what's to come next. And if it starts, parents understand that. First of all, it's empowering. It's actually very exciting. And we do a lot of that. And it's, people dismiss parents who live in poverty, and they go, well, whatever. But the fact of the matter is that for all these decades that we've been working with children and families, I don't think I've ever met, with the exception of people maybe with serious mental issues or addiction issues, I don't think I've ever met a mother of any socioeconomic background in rural Arkansas, in New York City, that didn't really care about their children and weren't entirely receptive to messages of hopefulness that the next generation can really be extraordinarily powerful and begin to address the big problems that we're facing here. I mean, we are, climate change and poverty and, all sorts of issues that we have to deal with. And we'll need every one of those kids on board, but it really starts with parents. Yes?
Well, I'm just curious while we've been distracted these last 2 years by DC, I'm just wondering how much ground do you think has really been lost in terms of safety net for children, what we have to repair when we get out of this very bad period of time?
Well, we are losing ground. There's no question about that. But I think there's something really important. This is what I come back to, which is what I was saying before. You mean you're actually undermining access to basic services for children? You mean you've got a Department of Education that could care less about public schools and education for children who really need it? We're not going to let this happen, and if it does happen, we're going to fix this, and we have to fix it, unfortunately, by making political decisions that are appropriate. But I think that the level of involvement in our political system that we can see in the United States is about to skyrocket, and I think that's going to be the antidote. It's going to be really rough, and believe me, this was not the outcome of November 16 that I was hoping for, but this is where we are. And I think the other thing, unfortunately, with the internet and just social media, in addition to who we elected in 16, we also have an environment now where the possibility of spreading messages that are very, very negative and very unfortunate sort of amplifies what's coming out of the, Tweeterverse there, out of the White House. So, did I answer your question? What did you want to know what? Yeah, sort of got lost in my own figuring out what to say. Yeah.
Where are they working around the edges of things that we consider sacred, like chip?
Yeah. So this CHIP, and by the way, there's a program called the Earned Income Tax Credit, EITC, which is the way out of poverty, basically. All we have to do is bolster that at a fraction of what people think it might cost, and we could be in a very different place where the floor of the income spread at least allows people to sustain and to thrive. Not everybody's buying a yacht, but everybody should be able to take care of their children, make sure the kids are happy, their well-being is taken care of, and they're going to school and all that. And that's doable. It's doable immediately. And so I think there's pathways, and the Trump administration is rolling back all kinds of regulations that have to do with environmental protection. They just fired or put on furlough the really phenomenal doctor epidemiologist at the EPA that's responsible for children's programs, just laid off today. Unknown reasons. And this is going to be, unfortunately worse before it gets better, but I think it will get better. And I hope you do too. One more? Please.
Very quick question. I assume your organization needs volunteers. Is there a way we can find out how we can help?
Could you give the microphone to Karen Redlener, please?
We can, let's talk after. But
Yeah, I mean,
supporters are really important in all ways.
we're hemming and hawing slightly because of regulatory issues. We don't use volunteers like on the actual medical programs taking care of children. You can't do that anymore. But there's many other ways in which the volunteers can help the organization and help us thrive, help spread the word, help in the advocacy arena. There's lots of ways. But if you mean volunteer in terms of, actually dealing with patients, so that's not doable, but there's a lot of other ways that we can. Oh yeah, I do. And why don't we talk upstairs at the reception? What's about politics? Yeah, thank you.
Obviously, there's an agenda for the reception too, so please come upstairs and continue the conversation.